Well, today on the show, we're back at the office of Dr. Vince Mitchell here in Biloxi, and we've been here before talking about neuropathy and everything, but one of the things that he uses to help people relieve pain, not only neuropathy, but in other areas, is a cold laser. And I tell you what, Doc, it's something how technology has come so far ahead now, enabling you to treat people with aches and pains or different problems with the use of a cold laser.
Yeah, Jim, and I appreciate you coming in again. Thank you for showing up and coming in. The first thing I want to make people aware of is that this cold laser is an M6 cold laser. There's a ton of lasers out there on the market that actually can do a lot of these things, but we have found that this M6 cold laser by Cutting Edge is actually a laser from Italy. And in other words, we have to get that laser on this tissue. So in other words, neuropathy is a dying out or a dysfunction of the disease of the nerves. So we hit this nerve or we hit this area with this cold laser from anywhere from 6 to 8 minutes. It depends on the condition. So here's what the cold laser, how does it work? So let me go ahead and point to a couple things that we've got to get oxygen into the blood, into that injured tissue. That's the first and foremost thing, okay? As time goes on, we start getting a proper realignment of the collagen. So the collagen, that's really what makes up scar tissue, so we can actually start getting scar tissue to start healing better. So if you're post-surgical, we can have you come in here, either lower back surgeries, neck surgeries, we can have that and put that laser on there as well. The big thing is that it decreases inflammation and edema relatively fast. I mean, you could put ice on an area, you could put electric stim, you could put all that stuff on there. It's going to help. Take pills, potions, and lotions, but we have found out that this M6 laser really does a fantastic job. It really cuts everything in half the time, and it's just amazing results. Also, nerve regeneration, especially for the patients that are washing that have peripheral neuropathy. Right now, a lot of you are probably sitting at home on Neurontin, gabapentin, taking Lyrica for your peripheral neuropathy, and those are things that are just not going to help you. It'll help alleviate some of the symptoms, but what we're going to do is we want to try to help regrow or regenerate some of the blood around those nerves, and this laser will do that, okay? And we also talk about cartilage production, and it helps out with that as well to get the cartilage and the collagen back into that nerve.
I tell you what, you've had some great success stories too. So we brought some folks in here that we want to talk to and show you how it's helped them. Miss Odom, nice to meet you. How are you?
I'm good. How are you?
I'm well. What brought you to Dr. Mitchell?
Well, I was having a lot of pain in my left knee, and so I saw his advertisement and I came down for a consult.
Okay.
And he said he could help me.
Okay. And so, I mean, they used the laser on you, the cold laser on your knee?
On my knee.
How long did it take for you to notice something, notice the change?
I started in December, so in about January, end of January.
Okay.
I was able to do things that I hadn't been able to do.
And so now, I mean, your knee feels a lot better.
A lot better.
An emphasis on a lot. That's so. How often do you come in for a treatment?
I come in once a month now, but I was coming 3 times a week from December to April.
Wow! And now just down to once a month, and you're doing great. So you just get out and just boogie and have
dance,
a good time.
whatever. Walk, go shopping at the mall.
Oh well, I heard that. Of course, you can combine the walking and doing that. But it's been really helpful for you.
Yes, it has.
All right.
Very helpful.
All right. We got somebody else we want to talk to right now and find out how it's been helping them. Mr. Parker, pleasure to meet you. Glad for you to be on the show with me here. Tell us about the pain. Now, you have neuropathy in your feet.
Well, see, that was my trouble. People didn't believe what I was trying to tell them because I didn't know what it was.
Right. So what were you doing to help yourself?
I tried diabetic shoes. I'd done everything. Pads.
It didn't work. I mean, for a time you were getting shots.
Well, yeah, I was getting shot. That didn't last too long. But I'd taken change shoes about every once a week if I was doing a lot of walking.
Yeah.
Because I couldn't walk. I'd walk around with her shopping. I'd find me a stool or something to sit on.
Now, then you found out about Dr. Mitchell, and you came here. And how did he help you out?
Well, first he examined me. Then he tested me with that, I don't know what you call it, little needle.
It's technical stuff, you know.
Anyway, he checked me on my feet. I couldn't feel it. Then I think it was the next week I come down here and got on them machines. I don't even know the name of them either, but
Long as they helped you,
I enjoyed them.
kind of gave you a lot of relief on your feet
Yeah.
now. And you, how long were you? I mean, when you started out, how many often were you coming?
3 times a week,
And now,
once a month.
wow. So it's been really great for you.
Yeah,
That's the main thing. Mr. Parker, thank you so much.
already.
We got some more relief to talk about here. The Gulf Coast Knee Pain and Neuropathy Center in Biloxi. Now, this is the actual laser unit, correct?
Yes, Jim. This is the M6 laser in action. We've got the assistant here by the name of Yvette, and this is Angela, is going to put the M6 laser on the lower back. And in reality, this laser is very deep penetrating, so I really shouldn't be looking at it without any kind of goggles on.
I'll turn my head, you look.
What I'll do is I'll go ahead and kind of tell you a little bit about this, is that it's going deep below that skin tissue. And like I mentioned earlier, a lot of lasers can help out with ailments like this, but we have found out that a lot of times that treatment time is cut in half. So instead of getting 20, 30 treatments, we can actually do it within 8 to 10 to 12 treatments.
Wow.
And we can actually see benefits within the first two or three visits. The M6 laser, I implore anybody to learn more about it. They can get on YouTube. They can type in M6 cold laser on YouTube. They can see a lot of surgeons, a lot of podiatry, a lot of pain management doctors that is using this exact same therapy from Italy.
Okay, now if somebody's interested in having this done, they need to pre-qualify. Tell us about that.
Yes, Jim, they do. Anybody who's watching today is that we have to qualify you for having any kind of neurological type symptoms. The first thing is that you have to call our office, okay? So
Right.
if you've been told out there who's watching that you have neuropathy, or you've been told that you got to live with the neuropathy, or there's nothing else you can do for your neuropathy, I implore you to call our office, talk to Yvette. She'll answer any questions you have. She'll set you up for a time to come in to evaluate you. Our advanced neurological treatment program can find out exactly if you are a candidate for this office or not a candidate. For $60, you can come in, we can rule you in and rule you out. If you are accepted, we'll apply that $60 towards your program. If you're not accepted, I don't want your money, we'll shake hands, our professional relationship will end right there, and I'll reimburse you the $60.
That's awesome.
You can't get much more simpler
No,
than that.
you can't. Again, if you want some more information, you want to set up an appointment for a consultation, the phone number is on your screen. They're located off Pass Road in Biloxi, just east of Keesler Federal Credit Union. It's the Gulf Coast Knee Pain and Neuropathy Center. If you are experiencing some pain from neuropathy or some other aches and pains, I'm sure they can help you out. Give them a call, set up an appointment, and come in today and find out. The Gulf Coast Knee Pain and Neuropathy Center in Biloxi.